The COVID-19 disrupted our daily lives. It has brought about fear, anxiety, depression, and uncertainty due to increasing infections, negative effects of the lockdown period. A lot of negative COVID-19 information has been circulating on social media, adding to the adverse mental health challenges. Going on to this project, before we used to engage communities physically as part of our drive to enrich our research through learning and sharing with the community, and also to empower communities. So the emergence of COVID-19, what it did is it ushered a new normal which restricted physical engagement. So we had to adjust and also do engagement virtually. Hence for this project, we saw radio as an ideal medium to engage the Zimbabwean audience at large regarding their mental health during this COVID-19 era. And it proved quite an effective medium of engagement.
We have opted to use of radio programming. The radio programming allows us to reach to a wider audience. We were broadcasting from Harare, but we reached the whole nation, something that we could not do when I was doing my CPE activities in person.
We held 4 radio programs on Star FM Zimbabwe. We used drama as a key tool to trigger discussions. First, we focused, that's our first drama, it focused on children and adolescents' mental health during this COVID-19 period. Lockdown restrictions meant children could not go to schools, they could not go to play with their friends. So this affected their mental health in a great way.
Children have been facing common mental health disorders even before COVID-19, but then with the coming of COVID-19, they became more exposed to a lot of risk factors that influenced the development of mental health disorders. Those mental health disorders, if they go untreated, they can also lead to other problems such as juvenile delinquency, suicide. It also affects their performance at school.
Secondly, we looked at the impact of COVID-19 on substance abuse. COVID-19 led to an increase in substance abuse as some people who had lost their jobs due to COVID-19 turned to drugs as a coping mechanism.
Saka nawe kusaenda kubasa nepamusaka pe-COVID-19 ndakwanishandisa zvinodhaka pamusaka pekushaya zvekuita nekuswera ndipamba. Ndiri muna mhuri ndine vana 2. Saka dzimwe nguva mwana akwanisa vana vangu varikugara nanamai takadhivorsa zvedu, asi ndindosapota vana. Dzimwe nguva anamai vanisa kusvika ndakadhakwa ndobva ndaitange ndiri munhu ari negligence asina hanya nevana, asi dzenziri stressful dzatorarama nadzo nepamusika peCovid. Nandikushanda kumakombi, nandiri conductor wemakombi. Tichakwanisa kuwana source income nekuti mawana taita mari nematsvagiro ataita tichakwanisa, saka kurarama kwacho kwakutiremera.
Semazuva ano nenyaya yeCovid-19 vechidiki vari kufungidzira kuti tingazorodze pfungwa tatora zvinodhaka.
We are disseminating the evidence that is factual to the community, because the other thing that drives mental health and substance abuse is the perpetual myths and misunderstanding about these problems in the community. AMARI is coming with a sound voice that is evidence-based to say these are the problems at hand, this is the scale of the problem, and this is even the quality of the life that the people are leading. Youths are pressured to find ends of making things add up, but the options that are available to them are so limited. They are illegally trading in fuel. They are illegally trading in drugs. They cannot support even those people who are dependent on them. And then when we come with these radio programs that we are developing, we are trying to send a positive message that there is hope.
Vechidiki nevechikuru vari kutotamidzana zvinodhaka vachinyeperana kuti COVID-19 stress free kana kuti alcohol takaimwa inodzinga COVID-19 yapinda mukati. Izvo zviri izvo zvokunyepa.
Then thirdly, we focused on women's mental health during COVID-19. We saw that women's responsibilities, they increased as a result of COVID-19. Hence, this was a key discussion on how best they can cope in this new normal.
Women are naturally the backbone of the family, and everybody in the family depends on them to provide food, to nurture them, to take care of them. Children are not going to school, and the mothers are the ones that are expected to be teaching them at home. The advent of COVID-19 restrictions especially have put a burden on the women, an increased burden. Now they are more at risk of developing depression, anxiety, and other common mental health disorders. These lockdown restrictions have also restricted women to staying at home, such that their side hustles that they have been doing to complement their husband's salaries have stopped. And so they increases the chances of them having no economic empowerment, just leaning on their husbands to provide for the family. At the end of the day, the money is not enough. They cannot provide enough food for their family, and that also might actually lead to gender-based violence.
Lastly, we looked at the general psychological effects of COVID-19 on mental health. COVID-19 has brought about fear, especially of infection, fear of death. So all these issues, they were quite topical issues that our audience could relate and respond to.
COVID has brought about changes, and most of them are negative, but we've got to do what's got to be done. We've got to come up and embrace the new normal. What we noted is that the people who respond positively are those who are well informed about the condition. I noted that amongst healthcare practitioners, those who had been trained, who had been briefed on what COVID is about, those who had accurate information are least affected mentally. There is a lot of stigma surrounding the healthcare worker who themselves are also working under very stressful conditions, fearing infection themselves and also fearing to infect their family members. We've been supporting healthcare workers during the pandemic, and some of the concerns that are coming from them is, should I hug my child? Should I breastfeed? Should I live in isolation? Unfortunately, not everybody can live in isolation because we don't have enough room for that. What is helpful for people out there to take care of their mental health is to make sure that they get accurate information, because we know one of the things that sustains a person emotionally is for them to have awareness. Self-awareness, what is it that triggers me? What am I concerned about? What am I worried about? What sort of support is out there? So getting accurate information is helpful. And we encourage the use of reliable websites like WHO, where you know that you get accurate information concerning the pandemic, and also just staying connected. We may not be able to be physically there for each other, but we can actually connect with people who are far and near. I've actually seen that there's been increased communication even amongst relatives who are abroad. These Zoom meetings that I was talking about, people are holding baby showers on Zoom, funerals on Zoom, even connecting, seeing relatives that they had not seen for a long time.
What I took out of these engagements is that there is still a lot that needs to be done in terms of mental health, spelling it out clearly to the public, especially when we are hit by pandemics such as the current COVID-19. This project sought to promote mental well-being during COVID-19, hence we worked closely with the Friendship Bench as a referral point for counseling services that it is providing online. The public need to be empowered and well equipped with the correct information. So this project has been quite an experience, and with more funding we can surely continue engaging and empowering communities even virtually. It is quite possible.